Have you been wondering what is entailed in GP fellowship exams in Australia? Are you one of my viewers that have been asking me talk about the GP exams, what they entail, what it's all about? And are you just somebody that is hopping onto my page for the very first time? In today's topic, I'll be talking about GP exams in detail, and I'll be talking about just essentially the overview of GP fellowship exams in Australia. If it is your first time here, my name is Anna, Migrant Doctor Mom. Thank you for joining me. And if you're my returning subscriber and you're finding this content important, please like, share within your circles, and subscribe for more comment. And do not forget to hit the notification tab. Then that way you will know as soon as I upload my videos, you'll be able to listen in. So that aside, let's get to the main thing that has brought us here, explaining the GP fellowship exams. So essentially, the GP fellowship exams are into 3 different exams. But before I talk about that, you need to be eligible before you can apply for these exams. How should I know, or how can I know that I'm eligible for the exams? So the answer is as simple as you need to have, covered about 2 years of your training time. I've done another video on this about GP training and all that, but essentially you need to have done your hospital year already, and you need to have at least completed your GPT-1 and GPT-2 by the time you're sitting your exams. So that is essentially after 12 months of being in the community GP practice and you finish the training required in terms of timing, you should be able to apply for your GP fellowship exams. And obviously make sure you apply within the stipulated time, because there are timings and there are deadlines that you need to meet before you sit the exams. So sit back, let's go through this. So GP fellowship exam is divided into 3. So the first one is what we commonly call an AKT, which is essentially just the applied knowledge test. The second test is what we call KFP, and that's a key feature problem exam. And the third one is called a CCE, which is clinical experience. Sort of you go through various clinical scenarios, and through it, you are assessed to see whether you are ready for general practice to work independently. So I will go through each of these, and probably as I go along, I'll throw in tips here and there. And and if there are any questions that you won't be clear on, by all means, just leave a comment. And if you've gone through the GP exams and you found something helpful that you need my viewers need to listen in, kindly, I urge you to comment down there as well. So AKT, what's AKT? So it's essentially applied knowledge test. And what are they? You're applying your knowledge, and then it is a test. So remember, the thing with the AKT is it's not only the knowledge that is being assessed, but the application of the knowledge that you've acquired. So essentially in the context, and the context again is the Australian general practice, and rather than just, covering a broad spectrum of knowledge. So you will notice in all the GP exams, you will never be asked a direct question, what are the causes of 1, 2, 3? What are the causes of a rash in a child? No, all the exams will come in a clinical scenario, because again, it is general practice exam. Again, no patient will come to you and say, this is my rash. What is the cause of my rash? Somebody will come to you, they will give you the clinical scenario. They will tell you, my child has been well until about 5 days ago. They've developed this rash. It is itchy, it is painful, it is localized in my flexures, in my joints and stuff like that. They'll tell you this child has no fever, has not had a viral illness and stuff like that. So you will notice the exam is a scenario. And then on that scenario, they will ask you, the exam questions are set off in 2. So one of them will be, they are multiple choice questions. You can either be asked the best answer, or you can be asked like a modified extended matching situation. So they may tell you the best 3 tests to do. So for example, they can give you a scenario, a young man presenting with dysuria, which is like, burning, stinging, going more frequently, has some pain as well, blah, 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 blah. Then they may ask you, which is the next best test that you're going to do, and then they will list there for you. They'll list for you a urinalysis, they'll list for you a microscopic culture sensitivity, they will list for you an ultrasound, they will list for you blah, 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 blah. The question is, remember, I always tell people the question is, and the answer is in the STEM. So go back and ask yourself whether they're asking what is the gold standard, or what is the best, or what is the next. So remember, for example, in the scenario that I've given you, the next would be, because you're in the practice, you have to do a bedside test. What is the bedside test that you're going to do in your practice? You're going to dip that urine. So your answer will probably be a urinalysis. So you will dip that urine in your practice, and if there are looks and nitrites, you start treatment, and then obviously you'll send the urine off for a microscopic culture and sensitivity. So very, very important to understand what the question is asking. And that's why they're talking about it being an applied knowledge test. They know you have the skills, they know you have the knowledge, but how best can you apply that knowledge to the patient sitting in front of you? And the patient sitting in front of you will be the question number 1, number 2, number 3, number 4. AKT is 150 questions, so there is no negative marking. So I would always say attempt all the questions, You lose nothing by attempting all the questions. And one other thing that I noticed as I was preparing for my exams is time. Remember, it's a 3-hour test, 150 questions, divide that by 180. You probably, because 3 hours is 180 minutes and there are 150 questions. So roughly, you probably need to use about sort of a minute or just slightly more than a minute per question to be able to finish that exam. So you really need to be smart, underline the important things that they're asking you, underline the age of the patient, underline whether they're male or not, whether they're sexually active or not, underline the things that are important, and that way you get the question that they're asking for. And you can easily get really, really high scores by, knowing what is requested of you and what is expected of you. The other question that they may ask, the type of question, is a modified extended matching question. Like, for example, they may list for you a couple of investigations that will be applicable to your case. Then obviously you look at what is applicable to your case that they've asked you and choose 1, 2, 3. If they say 2, increase your chances of passing, pick 2. If you're sure of 1 and you're not sure of another one, take a nice best guess. Come on, you have to guess. Put 2 answers. If they say 3 or 4 best answers, put 4 answers. Don't lose marks. Put 4 answers so that you increase your chances of passing that exam. Very, very important. No negative marking. So just do what you have to do to pass that exam. So that's AKT. It tends to have a little bit of a better pass rate compared to the next one that I'm going to talk about, which is the KFP. So KFP, like I explained earlier, it's a key feature problem exam. So they assess your clinical reasoning and decision making. So it's your reasoning and how best you make decisions in the context of Australian general practice. So it may actually assess, you may actually again get a clinical scenario, and every clinical scenario will have the age of the patient. They may tell you whether it's male or female. They may either tell you whether it's Aboriginal or not. They may tell you that the patient lives rural, remote, or metro. Very, very important to think about those things because they will determine how you answer the question. Okay? What you will do for a 98-year-old discovered to have bowel cancer compared to somebody who is 38 and diagnosed to have bowel cancer is completely different. Okay? Or another good example is what you will do for somebody that lives really, really remote, an Aboriginal man that does acknowledge country and doesn't want to leave country to seek healthcare in the metro hospitals. You need to understand that there are some things that you may need to do while the patient is still in country. So amongst your answers will not be referred to the nearest tertiary center as your number 1. You may need to call the tertiary center for advice. You may need to do the initial investigations while you're still in country. You may need to discuss treatment options via telehealth or via whatever means you have with the patient, or a case conference with the patient in your practice. Before, you may have to explore all that before you suggest this patient transferring. And if patient can get care while in the country, that needs to be your priority. So it's very, very important to look at your scenario in completeness, to be able to know what is going to be your best answer for this patient, or for this patient in your test. Because remember, at the end of the day, it's a test. And at the end of the day, this test translates to exactly what you will see in day to day. You will see, you may get an Aboriginal family that does not want to leave country. But again, you need to provide the best care for this patient in the context of where they are. So the answers may be varied. So the question may expect you to write simple answer, or it may ask you to, so it may either assess you for written response, or you may actually be asked to explain how you're going to manage the patient. And it's very important to understand the STEM. I always say the answers are in your STEM. If you're not sure, go back into the STEM. There's something that is hidden in that STEM that will open up the answers for you. And then remember, there's something in KFP called overcoding, and there's something in KFP that you need to be as specific as possible. For example, if I come to you and I have like metabolic syndrome, or I am obese, or part of your management, and you're asked to manage, what are your management options? What are your non-pharmacological management of this patient? You cannot just write there lifestyle modifications for this patient. No, you need to be as specific as possible. What do you mean by lifestyle modification? If it's exercise, you need to be as specific as possible. 30 minutes of exercise most days of the week, plus additional resistance training. Or you need to say, increase dietary, something. You need to be as specific as possible, okay? What other good example can I give? Like, let's say, you cannot just say, like lifestyle modification, stop, alcohol or something like that. Be as specific as possible. If you need to link up this patient to Anonymous, to AA, then right there that I will refer the patient. And remember, the other important thing in KFP is they are also looking at how interprofessional you are. The things that you may, as part of your non-pharmacological management, is refer a patient who has osteoarthritis to a physiotherapist, or refer somebody that has a mental health condition to a psychologist. So remember, as a GP, your main role is you are somebody, they actually call you a specialist in life. So essentially, you are somebody that knows the patient well. You are somebody that's going to sort of move the patient around to the important, you're supposed to link up the patient to the important service. So you link up the patient to the appropriate specialist. You link up the patient to the appropriate allied health. You link up the patient if they need my aged care assessment, you link them up. If you need to do advanced health directive or enduring power of attorney, all those important things. If you need to fill their driver's license, remember, you need to think about all these things. If you see an elderly patient coming to you, they have a lot of comorbidities, they're having lots of falls, they're having memory issues, you need to think about the medical legal aspects of managing this patient. So, and that's why I said age is very important, because for a patient that's elderly, you need to think about memory. How are they coping at home? What is their falls risk? Are they having polypharmacy? Are they needing social support in the home? Are they linked up to my aged care? And then obviously you need to think about end of life discussions that are very vital at this moment, that we are encouraging everyone to discuss with their elderly patients, because these things are important. You cannot allow a dementia patient, who is very forgetful, to continue and renew their driver's license. So it's very, very important to look at the entire clinical scenario, look at the age of the patient, and offer the appropriate answer for that specific case. And be as specific as you can be when you're answering the CCE questions, because In CCE, if you overcode, you actually get a lesser mark. And by overcoding is essentially if you're asked to offer one pain relief for a patient, like one management, like one medication for pain, you cannot write there Panadol and Nurofen. You need to write, you either decide whether you're giving Panadol or whether you're giving Nurofen for this specific patient. So be as specific as you can, and that way you will pass your AKT. One last thing I must say is, if you're using my previous tips on how to ace your exams and you're using a discussion group, this is the time that during your discussion, pause and write your answers. That's what I did. That's what me and my discussion group used to do. We would pause and write our answers as specific as we would do in an exam. And we would mark each other and we'll correct ourselves on overcoding. We'll correct ourselves on not being specific. We'll correct ourselves over and over. And before you realize it, you've got the structure right. And regardless of what question comes your way, you'll still be able to answer and hopefully still be able to pass. So the final exam, which I must say the pass rate is pretty good, is the CCE. And in the CCE, it's essentially you're given a clinical scenario. At the moment, a lot of it is being done online via Zoom, but again, it can be done in person. It used to be done in person in the past. And essentially what you're given is 9 clinical scenarios. So on the 9 clinical scenarios, 4 will be case-based discussions and 5 will be what we call clinical encounters. So in clinical encounters, you will be expected to talk to a patient who will be a role player. And they have, I always say in CCE, your role player has the answers. You need to have very good communication skills to be able to know that they're leading you onto something. And one thing I like about this, your patient or your role player, is they are so knowledgeable enough to, if you listen, take their cue, take their body language, take the cue. And sometimes as part of my structure was I would ask the patient, is there something that you want to talk about? Is there something that we have not covered? And one thing that I learned from my GP Academy course is that sometimes when you feel like time's really, because remember you need to manage your time in CCE. You need to manage, especially in a clinical encounter, it's 15 minutes. They give you reading time, but it's 15 minutes to finish your case. So my approach was I would do, my reading, and then during my reading, I would write my short notes, and especially I would look at the question they're asking. So in there, they will ask you, take a history, and then I would jot down in my history, I'm going to do history of presenting complaint, social history, background history, blah, 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 and I would write my little notes of what I would cover. And then I would come to, if they've said management, then I would write the non-pharmacological management, pharmacological management, follow-up, red flags, medical legal aspects that I need to consider. And then I would write there as an AOB, sort of like, is there something else you would want me to? And obviously I would always throw in your question, I provide reading information or reading website that the patient can go home and have a little read about. So very important when you're managing your time. So you manage by like 7 minutes, you should have done the history and then management. Because at the end of the day, you don't want to finish a case and then you ask the patient, is there anything else you would like me to address? And then they tell you, my mom needs ACAT, referral. So in that point in time, you realize you haven't covered the ACAT referral process. So then that way, you'll probably say, touch and go. Look, in ACAT assessment, we'll need to refer you to blah, 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 blah. We'll need to do this. I'll give you some reading information and we'll make an appointment for you to come again for another discussion, because that happens in general practice. You get caught up with time. But what do? You offer the patient another appointment. But you tell the patient you're coming in because you need to we'll cover in the next appointment 1, 2, 3, and 4. So very important to manage your time appropriately, to touch and go where you need to touch and go, and to look at what the question is asking. If you do not understand, I always say this, if you do not understand the assessment, if you do not understand an experiment, you would bring out the results you need to bring out. One other thing about CCE is your case-based discussions. Your examiner will take charge of, time management. So you will notice they will ask you a question, and then even as you continue to explain, they will move to the next one. So be smart, okay? Be smart enough to try and give your bigger aspects in as early as possible, and then just keep talking until they stop you. When they stop you and they go to the next question, and anticipate what they're likely to ask you. Because remember, it's a patient, so it's either will be the history, it will be your physical examination, it will be, they may ask you, what are you going to be looking for in the examination? What test are you going to ask for? Follow-up and stuff like that. So you kind of know what are they likely to ask, you know, and then that way you've like jotted down in your reading time, you'll have written how you'll approach it, because they're asking you, you need to have that sort of, structure in your head, so that you're answering and going and going and going until they stop you, because they are managing your time for you at that point in time. But just remember, in CCE, you need to manage your time, because remember, you will be marked against completing the tasks for the question, but you'll also be asked about, they need to see that you have understood the clinical domains of general practice, that you've history taken, you've examined the patient, you've offered treatment, you've offered follow-up, you've acknowledged the medical legal issues, you've acknowledged the red flags. If you need to refer the patient, you've referred the patient, you've offered options for referral, for allied health, for specialists and all that. So I feel if you develop the right structure really well, regardless of the question that you're going to be given, and especially understand your communication skills to the extent that if it's a CCE, you can read that the patient still has questions, they still have things that they don't seem like, and I always throw in, does that make sense? Do you understand what I say? Is there something that's not clear? Would you like us to talk about this a little bit more? And offer them to come back in with a friend, with a relative, or with a next of kin if they want additional information, and always offer some reading information as well that they can take home. So by and large, that's the overview of the fellowship exams. Look out for the important dates, because they do have dates when they come out. And then obviously, as you wait for the results to come out, take a breather, because you've done really well. You've done really well, and I hope this is helpful. And if it is, by all means, comment and share, and let's just encourage one another. Let's encourage one another, because like I always say, a candle loses nothing by lighting another. Thanks.